In the classical Chinese medicine, which is originated to very the beginning, which is what I'm mainly promoting is Yun Qi theory.
The Chinese medicine is more about keeping yourself healthy. You come and see a Chinese doctor to prevent you from becoming unwell.
Chinese medicine is not just belong to Chinese, not belong to Asian people. They belong to the whole world, being human being. Who's going to carry on this business? Who's going to carry on Chinese medicine? Who's going to become the next promoter or next practitioner of this?
At 10 o'clock in the morning, it is the beginning time for Dr. Bing to have a busy day.
I'm practicing in the UK, of course, Nottingham, and I've been doing this business for, in this location, it's been for 4 years, nearly 4 years, but I've been doing acupuncture more than 10 years now. My family have been doing this business for 3 generations. To me, it's the 4th generation.
Acupuncture is an alternative medicine and a significant part of traditional Chinese medicine. According to a general belief, it has almost thousands of history in China.
I would call it the classical Chinese medicine, which is originated to very the beginning, which is what I'm mainly promoting is Yun Qi theory. Like Yun Qi, 五运六气, 5 Yun 6 Qi. Yun Qi theory is the very beginning of all Chinese medicine. So this is the core of Chinese medicine, because they're not just talking about a human being anymore. We talk about the environment, we talk about how this environment affects human being. And what's the disease, what's the cause of disease, not just the virus, not just even just the virus, why they come from. Or bacteria, where they come from, how can we not fighting for the virus, how can we coexist? Because nowadays people understand virus, they can't be killed, they're going to always be there with us forever. So why trying to do the task and never going to accomplish? So why don't you just live with it? That's the topic Chinese medicine been studying for 1,000 years.
Sorry for being late.
It is too early.
As an experienced acupuncturist, Dr. Bing has treated many diseases. These patients need to have a preliminary inquiry to judge the symptom of the disease. Dr. Bing will carry out different acupuncture treatments according to the situation of the patients.
It's all what we expect. We treat different style patient. For instance, pain is one of them. Some patient might have skin issues. Some patient might have heart issues or liver issues, or could be any issues. So they basically tried everything they could from the mainstream NHS or any other therapist. It seems like it doesn't work. We seems like it's the last stand. They come say, well, they try acupuncture, see how it goes. Pain patient probably just a 30 to 40% of pain patient, a 20% of would be depression or anxiety and mental issues. This kind of patient, that counted to probably 60% and another 40% could be could be anything like skin issues, just like I said, even cancer patients. Of course, we don't treat cancer, but we do some treatment to help cancer patients release their symptoms. Of course, pain is one of them, or any other, appetite, or they lose their appetite, they lose some weight, they are suffering swollen body parts, swollen food, swollen feet, swollen abdominal area, all sorts, or sleep issues, they can't sleep, and anxiety, of course, included. That's a difficult case. We call it, that's probably 40% of different cases, difficult case, I would call it. That's the left side. The left side muscle go a little bit deeper, so you might feel a little bit deep vibration or pulsing. Okay, can you feel anything coming here? No? No, go very slow anyway.
All the stress that's causing it, but I keep just getting ill all the time. It's been for the past few weeks now, months. Yeah.
Except for Asian patients, most of the patients in the clinic are Westerners or Britons. Dr. Bing will also encounter some difficulties in communicating and treating these patients.
Try both.
But which one do you make you feel? There are differences between these two types of patients or clients, what we call it. Chinese patients, or let's say not just Chinese, of course Japanese, Korean, they all come over to have the treatment. They all have the basic knowledge, like Chinese medicine, how it works. You don't have to explain to them in detail. Like say they understand yin yang, they understand the qi kind of thing. So you don't have to explain to them meridian, acupoint, they all know. So you just do the treatment. But Western country or UK patient clients, they don't normally understand how it works. So you have to pay more attention, give more time to explain to them what's going on. So why I put the needles here? Why I put the needles on your leg to treat your headache? They're confused. So you have to explain to them. So, but for me, normally I would say I'm the one of the few practitioner. I don't mention any qi, any yin yang. I use the language they can understand, which is the anatomy or the muscles, the nerves, any other like tendons or bones, because which meridians all rely on, or live on the meridian, the muscles. We are human beings. There's no doubt about it. Whatever you're gonna say it, what kind of system we're talking about, they're all human beings. So that's all the same. So for me, muscles or like acupoint and meridian, just different way to explain, to describe human being. So there's not much difference. Okay, difference is just the explanation. There's different. But of course, I chose this language to explain to them.
The clinic has treated many patients who are attracted by the effect of Chinese medicine and acupuncture. Dr. David, as a consultant addiction psychiatrist, is also very interested in Chinese medicine and acupuncture.
The difference between Western and Chinese medicine. And for me, I was actually originally, before I actually did medicine, I used to work for the pharmaceutical industry. So again, very much in terms of Western medicine. One thing in terms of Western medicine, there are a lot of things where you'll come along and you'll see the doctor, and the patient will actually say that they feel unwell, they don't feel right, but the doctors will do all the tests and then they'll say you're well. But the patient doesn't feel well. And clearly because of that, the patient isn't well in terms of things. But Western medicine, they dismiss it. And the thing that interested me also in terms of Chinese medicine is that Western medicine very much it deals with pathology, so it's almost like it's illness. Whereas it seems that with Chinese medicine, it's more about keeping yourself healthy. So in many ways, with Chinese medicine, the idea is that you come and see a Chinese doctor to prevent you from becoming unwell. Whereas unfortunately, in the Western medicine, you see the Western doctor, and then often you've got the illness, which in some cases might be a little bit too late, but it's certainly harder to fix.
He's not going to make an appointment. You don't need an appointment. That's what I'm saying. Just don't leave it too long.
在哪儿搞不完就手指但是第一次他们不会这样可以赶紧不然就不会
是病人是不来的吧他是不是排到做ANE
又去 ANE 了
ANE 做那个 MRI 我说你做
他这个排他还是得跑去 ANE 做不管他
他们桌上就是最好的，他取消是吧？
Got the background, the back of the system. Otherwise, no problem. If each time change, they go back again. This is your record.
Dr. Li, a young doctor who is communicating with Dr. Bing, is also an acupuncturist. In addition to assisting Dr. Bing in treatment, Dr. Li has rich experience in treatment such as pain problems, stress, and depression. In daily work, Dr. Bing will also exchange the practice experience with Dr. Li.
One of my job, trying to pass on this knowledge, not just to Chinese practitioner. So I try to pass on this knowledge to Western, like a therapist, like a physio, or either they're physio or acupuncturist. They're more than welcome come over to learn, or if they want to learn, I'm happy to teach them. Last few years, since 2016, I think 2016 till now, I've been focused on pass on this knowledge to Chinese medicine practitioner, and in UK and also in Europe. We did a very great job, and now we become very, very well known now. But not this clinic. We got another organization, mainly do the charity work called ACA Spirit, 英国学龄. It's now become very well known brand in UK and also in European country, because we have been doing since 2016. We've been doing quite a lot of lectures, workshop, conference, and trying to pass on Chinese medicine.
The ideal way forward is integrated medicine. So Chinese medicine extremely good when it comes to chronic diseases. Western medicine isn't so good. When it comes to acute trauma and things, while Western medicine is pretty good in terms of things. So you know, the mix between them, integrating them, is probably the way of going forward. And there's something what they talk about, things like energy medicine, and acupuncture is energy medicine in terms of things. But Western medicine's energy medicine as well, but they don't call it that. So it's something, yeah, they call it pharmaceutical medicine.
This business 2018, I think it's 2018, and then we now become like top 3 acupuncture in Nottingham. So this is the second year, 2022, with the second time we got this like a top 3 acupuncture.
For Dr. Bing, the future of the clinic and the inheritance of acupuncture and traditional Chinese medicine has always been the direction of his efforts. Nowadays, acupuncture has been well developed in the UK, but in the actual development process, it has many difficulties. But to the point is how to inherit acupuncture and how to integrate acupuncture and Western medicine in the UK.